Senator Dodson. Senator Roberts.
Thank you, Chair, and thank you all for attending today. I'd like to ask some questions about Mornington Island following my questions last year, and then perhaps some general questions. How did the federal government allow the Mornington Islanders' situation, their health and well-being, to slip into third world countries?
So, Senator, Mornington Island, and I think we provided some answers to questions on notice that we took the last time. As you're aware, we work closely with Archos, we work closely with the community, but particularly with Mornington Island, we work very closely with the Queensland Health and Hospital Services there, and we are working with them closely to make sure that the services on the island are improved over time. I don't know whether Mr.
Could you tell me how you're working with the government?
Mr. Matthews?
So, well, there's a range of it. I mean, it's a very broad question, of course, when you get to health, because you can't differentiate the health and well-being from the broader people's social and environmental aspects around that. So I think really probably, the headline way I would say that response to that is sort of happening really is through closing the gap, which is the framework for government states to be working in partnership with Aboriginal and Torres Strait Islander people around improving outcomes generally. So I guess that agreement was signed, struck around the middle of 2020, so it's been in place for about 12 months, which really resets the aim is to reset the relationship, and it is looking around a broad range of factors to work in, I guess rather than doing things with, two people, it's that concept of doing things with people and bring them to the table, and then look at how the overall investment across those range of things from, education, employment and housing through to health and health outcomes, come together around that situation is probably really, I think is probably in a nutshell, the main context of your answer about how that's going to progress into the future from here, of which health is a part, but it is not the only part in relation to that, into that answer, I think. But that's also not a question. It is also, obviously, when you start to get into the provision of, hospital services on Mornington, that is, they're delivered by the Queensland Government, as is a range of the education services and those things. So it's not a kind of simple Commonwealth Department of Health question. It's a very broad question, and I think in that context, probably, understanding the landscape through the lens of where closing the gap is resetting that, and some of the other mechanisms, in particular where Senator Dodson was answering things like the development of the voice, are really, geared towards ensuring about empowering and encouraging Aboriginal and Torres Strait Islander people to be a little bit more in charge of their future, which will hopefully, that will lead to increased outcomes over time.
Okay, some wonderful points in that I'd like to continue with. First of all, I endorse and value your comments about needing an holistic approach. Health is just one part of it. So, and health is really an outcome of the whole way of life. So I understand that. What are the current initiatives? That was a very broad statement, but what are the current initiatives for working with the Queensland Government and doing anything directly? And the Premier of Queensland and the Queensland Health Minister promised to visit the island last year or early this year. Have they done so?
Look, I couldn't comment on anything from the Queensland Government or their ministers or intentions around that. We don't have visibility or necessarily monitor or track that, because that's obviously a matter for the Queensland Government.
More specifically, how do you work with the Queensland Government?
So from a health point of view, and our colleagues from the National Indigenous Australians Agency may be able to talk more broadly from a broader Aboriginal and Torres Strait Islander affairs perspective, but from the health perspective, probably from two mechanisms we do have what's called partnership forums with the Queensland in each jurisdiction, including Queensland, where they are regular meetings that usually happen a couple of times a year between the Queensland Health officials, the Commonwealth Health officials, and then officials from the Aboriginal and Torres Strait Islander health sector in Queensland, and they're largely geared towards trying to kind of increase the alignment between between the Commonwealth, the state, and the Aboriginal and Torres Strait Islander stakeholders that are, many of whom are delivering services in there, to ensure that we align our policy and our delivery as far as possible. And there are any, not probably talking about Mornington Island specifically, but there are a range of things that will happen through there. Many of the programs we talked about, including things like our syphilis program, will deliver services into Queensland. We have that will also acknowledge things like where probably over the last 2 years we've been looking to increase the investment in our Aboriginal and Torres Strait Islander health services, where we've probably put in about an increased investment in the Aboriginal community-controlled health system by probably a bit over 160-odd million.
What specifically doing what?
So the investment we've lifted into the Aboriginal and Torres-Strait Islander health services is really around increasing the primary resourcing that goes to primary health care delivered by Aboriginal community-controlled health services in communities. That's a little different from Mornington Island, because that does not have one directly on there. It does have some servicing through the an ISA service there into the community, but a lot of services delivered by the Queensland government in there. But what we're looking to do is increase the resourcing for health services delivered, primary healthcare services delivered by Aboriginal and Torres Strait Islander organisations, because they know their clients, they know the clients well, and they'll put in place a stronger framework around comprehensive primary health care. So that is something we've been doing across the country, not just in Queensland, and we'll continue to do over.
So is that funding for nurses or doctors or?
Both. It funds the resourcing of the Aboriginal and Torres Strait Islander health clinic, and then the health clinic will use that for any range of things. It might employ Aboriginal health worker, and it could be used for that. Could be used for doctors or nurses or other things that it may do from a comprehensive healthcare point of view, which is really about a patient coming in and not doing and sort of understanding their needs and then looking at their broader circumstance and spending an increased amount of time. So it's not, it's a little different from your visit to a normal GP situation, which might be a little bit sort of shorter. It's to sort of bring them in, spend more time, look at their other issues and try and provide some of those wraparound supports to people is really how the comprehensive primary healthcare works within a Aboriginal community-controlled health setting. So one of the things we're doing is to increase our investment in that over time and work with the sector in particular to expand that and look to improve how they service over time as well, which is their intention.
So how would you characterise not just the quality of the relationship, but the actions and the behaviours that come from the relationship? Are you a money provider? Are you a resource provider? Are you someone looking over their shoulder in a helpful way that identifies shortfalls in the Queensland government's approach? Are you advisors to them? How would you describe it?
Well, are you referring to the Queensland government or for the Aboriginal health services?
The Aboriginal health services with the Queensland government, not just Mornington.
Well, I would hope that the Aboriginal health services probably don't characterise us as they're just looking over their shoulder. Would be, I would hope.
I meant that in the sense that you're working with them.
Yes, that's very clearly our intention is to ensure that we have a partnership approach with our Aboriginal health services, which is one of the priority reform areas in the Closing the Gap agreement as well.
And that's exactly what I was going to add, Senator. We take the Closing the Gap agreement very seriously, which talks about a partnership with Aboriginal people and Aboriginal services. The money that Mr Matthews outlined goes directly to service delivery by community-controlled health organisations. We provide funding.
So it doesn't go through the state government?
No, it doesn't. It goes directly to the sector. It's deliberately flexible to allow them to address the particular issues around health and providing holistic health services to their community. So it's deliberately flexible to allow for that. And we work very closely with the National Aboriginal Community Controlled Health Organisation, but also all of the services to make sure that what we are achieving is a collective set of outcomes that everyone's agreed to around improving health and wellbeing for Aboriginal and Torres Strait Islander people.
Okay. Perhaps now would be a time to jump into a few things. Mr Matthews said, as I said, it was wonderful to hear him talking about an holistic approach. It's not just health. Health's an outcome of the lifestyle. What about personal accountability? The reason I'm asking these questions is that 2-3 people in my office and myself went right across all the Cape York communities. When was that? July, August, and visited all. And there were common, although the communities are quite different, as you would appreciate, different in their needs and their backgrounds, they have some commonalities. One, you mentioned Close the Gap, Mr Matthews. I put it to some of them that all the communities, and got this answer, I put it to them that Close the Gap perpetuates the gap. And they resoundingly said yes. And the reason for that was, first of all, the underlying intent is to focus on the gap, which perpetuates the gap. But putting that aside, there's also what some people call the Aboriginal industry. and it consists of whites as well as Aboriginals, but they're consultants, lawyers, etc., that feed off this, and they perpetuate the gap because without the gap, there's no Aboriginal industry. So any comments on that?
Well, sorry, Senator, can I don't want to speak for Mr Matthews, but our job is to make sure that we can provide comprehensive health care for all Australians. The government invests significantly in the health and wellbeing of Aboriginal and Torres Strait Islander people as First Nations peoples because of the disparity in health outcomes to date, and that is what the Closing the Gap agreement is about. We have worked tirelessly, and the community-controlled health sector has been a major part of the infrastructure of delivering health outcomes for Aboriginal and Torres Strait Islander people for over 50 years now. And to suggest that, in any way that is not a necessary and evidence-based investment. So I just wanted to clarify, because asking Mr Matthews for a comment on that, it is evidence-based, it is clear, it is a government commitment.
You would agree, I would hope, that personal accountability has a lot to do with managing people's health.
So, Senator, everyone, I think, across the country wants the best healthcare and the best for their family and themselves. And personal accountability is one element. We also recognise social determinants of health and a range of historical factors as well.
So you're agreeing with me that personal accountability is important. What...
Senator, I think I said it was one of the factors.
Correct. It's one of the factors, so it has a part to play. So what we've done in this country, under both Labor and Liberal, is that since 1972 we have, according to people in the communities, they've told me that we've created a sense of victimhood. Not beggars, but a victimhood. And that's the opposite of accountability. So what I'm trying to do is to get an understanding of the environment in which you work, because if that accountability is not there, and these people in the communities are wonderful. There's a diverse range of them, as you know, but they seem to be held back by the Aboriginal industry. Maybe not deliberately, maybe subconsciously, but that's what's happening. And a lot of it's been caused by state and federal governments, particularly since 1972.
Look, I think we can probably, we're probably a little bit limited to speak from the health perspective. It's obviously where our responsibility is, but I think it would be, probably just to repeat Mr Richner, I think it would be not right to characterise the Aboriginal and Torres Strait Islander health, the community-controlled health sector, which is delivered and run by Aboriginal people for Aboriginal people, as a, in a negative connotation around an Aboriginal industry. I think is that the reason we fund them is, I think, because of your point around which it is that services delivered, good services delivered by Aboriginal and Torres Strait Islander people to Aboriginal and Torres Strait Islander people. And we are talking about the provision of health services. There is clear evidence that it is effective in delivering it, because it comes from an empowering place of empowering people to do it. And that is why we are growing the sector strongly and investing in it and trying to work very closely with the sector on the way through. It's why, when I think if you were listening to Dr. Datoka's evidence around our response to COVID, we've also have centred that 100% with Aboriginal and Torres Strait Islander people and experts around that for that very reason. So
what I'm interpreting, and it's very welcome if I'm interpreting it correctly, is that you're giving more responsibility to the communities for their health and managing that health.
I'm sure that, and this is always very difficult to verbal, but I would imagine from our colleagues in the Aboriginal community-controlled health sector, they would say they are services that are that their membership is the community, and they're managed and their boards are elected from their community, so they would say they are in and of the community. Is how they, I'm sure, would express their view very strongly around that in terms of providing services to their own people.
Well, that's welcome news. So, is there a plan within your organisation that is part of an overall plan within the government's, I don't know, what's Ken Wyatt's department name, title? Department of Aboriginal and Island Affairs or Indigenous?
The National Indigenous Australians Agency.
That's right.
Thank you. Okay. Is there a coordinated plan with them working coordination with you?
So, Senator, and something you could, easily Googleable that is hard to find. So if you Google the National Aboriginal and Torres-Strait Islander Health Plan, you'll find that there's a recently released, National Aboriginal and Torres-Strait Islander Health Plan that was released on around the 15th of December last year, which is now a new 10-year national plan around Aboriginal and Torres-Strait Islander health, worked up very extensively probably led by Aboriginal and Torres Strait Islander health experts in the sector around the development of that plan, refreshed to be consistent with closing the gap and embed many of the things we've learned over the last few years. That was, as I said, released in the middle of December, and that has at its very heart that concepts of how the broader social determinants linked with health, and also very strongly brings in a dimension around the cultural determinants of health and how culture plays out for Aboriginal and Torres Strait Islander people and impacts on their health, and how health needs to respond to that landscape as well. So that's been recently refreshed, and I think would probably be, if you're looking at the national plan, where that is probably the prime and most important one to have a look at. So I'd really encourage you to do that. We can provide the link on notice if you like, to just to refresh if you'd like. If not, that's okay. And that would be well worth having a look at, and also noting that that is endorsed by the majority of the states and territories as well. So it does really form a plan now that is developed in and of through the Aboriginal and Torres Strait Islander sector, agreed by the Commonwealth Government, and endorsed by states and the majority of states and territories.
Okay, thank you. That's welcome news too, because there are a lot of outstanding people with a lot of potential in those communities who are just stymied by an invisible hand somehow. So. It's varying from, say, Lockhart River, where they're really going ahead, to other countries.
Senator Roberts, just quickly, we are very close to time, and I have one question that I would like to ask the officers before we finish up. So, if you could.
Last question then,
Thank you.
Chair. Thank you for that notice. Has there been a drop in the death rate from suicides in the last year, and what's the overall trend in suicide? Because it was quite alarming.
So, Senator, I might go to my colleague online, Mr. Rodham, who can talk about specific suicide data and prevention activities.
Yes, thank you. Can you see me and hear me all right?
Yep.
Yeah, great. Yes, so overall in 2020, Senator, there was a 5.4% reduction in suicide for the whole population. Unfortunately, for Aboriginal and Torres Strait Islander people, suicide remained the fifth leading cause of death that year. And Aboriginal and Torres Strait Islander people continue to die by suicide at more than twice the rate of non-Indigenous people, so 27.9 per 100,000 population compared with 11.8 per 1,000 population.
So can you tell me the overall trend? I know relative to the rest of Australia it's high, so thank you for that. Double. What's the overall trend? Is it increasing, decreasing, flat?
It did increase slightly in 2020, Senator, so I'm just trying to get the figures for 2020 compared with 2019. I know it was a little higher while the whole of population rate fell.
Senator, given the time, we can take that on notice and give you the data around the trends, but it also goes to why we are investing heavily in suicide prevention and mental health activities across Aboriginal and Torres Strait Islander people. We have a crisis line that's 24/7 that is about to be launched, and we'll start services from the 24th of February, and a range of other activities that Senator Dodson well knows we've been undertaking around suicide prevention.
And just like physical health, it's an outcome. Mental health is an outcome of cultural and other factors. Social factors, I think, Mr. Matthews' words.
There's a range of social determinants that impact on an individual's health across the board.
Thank you very much, Chair, and thank you all for attending.
Thank you very much.